Now let me start. You can have a look in the Zoom, all of you.
Yeah.
Right?
Yes, sir.
Clearly you can see, right?
Yes, sir.
That's great.
Sir.
Now first we will going to see this left side. We have selected the leg, so that indicating the spleen meridian we selected on the left side. If we are using on the right side, that means perhaps pancreas meridian or the spleen meridian also we can consider. But now let me see one by one where exactly there are the totally 21 acupuncture points are existing as a macro points on the leg region and also till the chest region. Now let me see, we will start by one by using the spleen one, that is the in pi. In pi the point is, there are the 2 points, 2 locations I will show you, but this the 2 locations also to be considered as a spleen 1. Now 1 point, the second point to be known as this point. So half tune lateral, half tune proximal to the medial side of the half tune proximal to the medial side of the this, which bone this is? TBL bone, right? A TBL bone. So at the junction of the black and white skin, this point is located. However, as a therapeutic level we wanted to use, we can use only at the nail base this point to be known as a spleen 1 point. This is the putial point or the jingwell point or the emergency point. This also to be considered as a wood point. Either you wanted to use 2 points, that means here I applied as a liver 3. So you can use the liver 3 and spleen 1. Both the functions are more or less the same. This is the earth point of the liver and this is the wood point of the spleen. So therefore both the points are same functions. You wanted to use 2 points together or you wanted to use as a single point, so spleen 1 or liver 3, but spleen 1 takes the energy from the liver, but when you apply the liver 3, that accept the energy from the spleen. So both the functions are more or less the same, but this very good point to treat for all the GIT related disorders, gastro related disorders, diabetes mellitus, and further obviously will be useful for the control the bleeding anywhere, because we know the spleen function is to control the blood. So therefore if it's not controlling the blood, this is the emergency point. Also this is the grandmother point of the spleen meridian. It regulates the wood and then spleen, it how the liver is controlling point to the spleen. If it is the over controlling, so that time to counter clock we can use this point, but specifically what time we can use this point. So this is as a the 10 o'clock is the morning is the peak time. So which time would be better? So this is the grandmother point. That means 10 p.m. is advisable. This is specific point 10 p.m. or the 2 a.m. would be better. So I wanted to use another point, anterior and inferior to the head of the, this is the metatarso-phalangeal joint. This to be known as a metatarso-phalangeal joint in the depression. Now you can press it. Once you can press, this is the web margin. This is the web margin. From here you come down. This is the head. This is the head of the metatarsal bone. From the head of the metatarsal bone, you come to the downwards direction, but not on the web margin. It's not on the web margin. But this point is located, press the bone, touch and feel. This to be known as a spleen 2. This to be known as the spleen 2. At the junction of the white and black skin, you can use this point, obviously good. This is the mother point of the spleen, but whatever the muscular system, the digestive system for diabetes mellitus, and to control the oral cavity and the lips dryness, and also to strengthen the gastrocnemius muscles or the knee pain or the back muscles or the GN muscles or the soleus muscles, any type of the muscles having the deficiency in our body, muscle wasting is there, muscle strengthening is not there, so that time certainly we can use a spleen 2 is a great point. At the same time, this is a good point to treat for the insomnia and also for the digestive related disorders, since this point is connecting to the heart. This is the fire point of the spleen, therefore SP2 is equivalent to the H7. So H7 you can use H7 You can use this point, otherwise you can use the point is spleen 2, that would be better. So any one point you wanted to select, you can use spleen 2. This is as a H7 sedated. This is a sun point, but this point to be considered as a mother point. So therefore I mother point, I towards the energy flow I activated. This is the H7. I opposite direction of the energy flow I sedated this point. Either you can use one point or the 2 points together would be better to treat for the any kind of the disorders. Then spleen 3 is the most important point. That point to be known as a, once you touch and feel the metatarsal head of the bone, this to be known as a head of the metatarsal bone. So just distal and then proximal to the metatarsal bone in the depression at the junction of this is the white skin, this is the black skin, but where the both the skins meets, so that point to be known as a spleen 3. So spleen 3, you just find out the depression. Yes, inside the depression, you just apply spleen 3 would be better at the junction of the black and white skin. I think, yeah, the meridian is going like this. Better we can apply. Take off that needle, apply in here. Yes. Good. Come this direction. Good. Spleen 3. So this point would be having the great effect is the horary point of the spleen meridian without disturbing to any meridian, but this is functioning for the strengthening to the spleen organ. The people says how the gout related problem, or maybe there is the uric acid get excessiveness even that time. So spleen 2 and 3 also really good for the gout metabolism as well. When the uric acid related, there are have given some of the other protocol as well, but this being a local point, also good point to treat for the diabetes mellitus and also for the gout related condition, and also the dorsal digital arteries when that get stagnation, so that time also causes some kind of the pain. That digital arteries also will be strengthening by activating this point. Now the fourth point to be known as a spleen 4. So spleen 4 is the Gongsan. Where is the location? At the base, in the depression at the base of the first metatarsal bone. Now how to find out? Then touch to the metatarsal bone. Touch to the metatarsal bone, you come down, you can find the depression. Touch and feel, you can find the depression. This depression to be known as a spleen 4. This depression to be known as a spleen 4. This is the cuboid bone. This is the medial cuboid bone, and then intermediate cuboid bone is the lateral cuboid bone. So anterior to the cuboid bone at the base of the first metatarsal bone in the depression, you can find this point. So I think somebody wanted to apply. Banniradamma. You just apply this point, spleen 4. Yes, you touch and feel from here. You touch and feel from here. Yes, you can find the depression. Halla ali valagade. Yes, you just apply there on the spleen 4. This is the grandmother and then grandson. This is the yellow emperor classic of the internal medicine. It says that, but there is the dynasty was there. Dynasty's king name is Kung Sun. So Kung Sun, king name, and then grandparents name they kept as a Kung Sun. Such a powerful point is really, since it is the Lu-Wo connecting point, nexary point, accumulation point, and communicating point for the stomach and then spleen. There is the external environment, internal environment, and exterior and interior relationship and binding to be taken place in between the stomach and then spleen. At the same time, this point to be known as a Chung Mai, or the Chung meridian, or the vital meridian, or thoroughfare meridian, or the energy meridian. So that meridian is connecting point to be known as a confluential point. Whenever you apply this point, Then make sure to apply the spleen 6 also. You can add up 1 point, you just apply here spleen 6 and then spleen 4. Both the points are good point to treat as a combination of the points. Whenever you apply, this is for the chest cavity, this for the abdominal cavity. The chest and then abdominal cavity is good, then of course the many diseases can be treatable by activating these 2 points. Now coming to this, the great point that's called as a shancho. So this point is you how to do that marker. So now I draw one thing. This is the tip of the medial malleolus. This is the tip of the medial malleolus, but I wanted to draw the horizontal line on the lower portion of the this is the lower portion of the lateral medial malleolus. I draw one line. Then I draw the one more line anterior to the anterior. This is the tip of the medial malleolus, anterior depression. So I bring from this depression anterior line of the medial malleolus. Then where at the junction of the red color marker. So this meeting point to be known as a shanchu. This point to be known as a shanchu. Meeting point. One is the horizontal line and vertical line. Both the lines meeting point to be known as a shanchu. Applies there. You just wipe it again. Then you just apply now. Yes, in the depression. So this is the sun point, that means is a sedative point. Sedative point you just apply is the opposite direction of the energy flow is advisable. Which direction? Opposite side. This I applied towards the energy flow I applied, but whereas in this point is required, the anti-direction of the energy flow, that indicating being a sun point is sedative point, slightly you deplete, otherwise you wanted to apply perpendicular also advisable. Now what is the beauty of this point? This point is located, this tendon is the tibialis tendon. Inside the depression of the tibialis tendon, anterior to the medial malleolus, this point is located. This is the metal point or the air point, but this point is connecting to all the blood vessels inside the body. Remember the importance of this point is connecting point. Spleen 5 is the communication point for all the veins in the body. All the veins. All the veins are communicating point to be known as a spleen 5. Therefore, any saphenous vein is affected, or the femoral vein is affected, or the some popliteal vein is affected, sural vein is affected. So that time you just activate this to regulate for the all the venous system. Because from here it ascends to the upward direction of the energy. This is because of the muscles got stagnated, muscles get stiffness, muscles wasting is there, otherwise the muscle spasticity is there. Due to that reason the muscles walls get blocked. The muscles walls are not opening to ascend to the upward direction. Due to that reason, this point it open up the blood vessels and also it open up the inside the muscular walls. That's called as a spider veins, and also thrombosis inside the blockages or the deep vein thrombosis. All together, this will be really helpful for the day-to-day clinical practice if the patient having the varicose veins and also there is a stiffness in the muscles called as a gastrocnemius muscles or the soleus muscles or the flexor digitorum longus muscles having some problem. That time can be cleared by activating this point. Spleen 5 every day ask them to give the pressure for 2 to 3 minutes every day, morning 2 minutes and then night 2 minutes, but this will be helpful to treat for the all the thrombosis related problem. And of course this point is located on the local point, then the talocrural joint related problems can be treatable by using this specific point. Now I am talking about the most imperative point for the day-to-day clinical practice. So that point to be known as a spleen 6. So where the spleen 6 is located? Remember from here to here how many chun?
13.
Yes, 13 chun. From here to here is, hold this. From here to here is how many chun? 13 chun. This is the half. This is the half. Then 13 chun means 6 and half. 6 and half. Then from here again, from here to here is half is this the half. Right. Then from here to here is 3 chun proximal. This is the 3 and half. That means the point is located ideally this particular point to be known as a spleen 6. So 1.5 kodama. 40 inches needle, 40 mm needle I am inserting here on the, you just try to find out the border. You try to find out. So on the border this point is located, but don't apply on the bone, you just apply inside the depression. So this to be known as a spleen 6. So if there is a hardness is there, then you just try to find out the proper location where this point is located. Relax yourself. Now don't change the position of the leg. If you change the position of the leg, inside the muscles get a slightly contraction, the patient feels a pain. So hopefully we understand this as spleen 6. Strongly manipulation will be good. Strong manipulation is always good. This to control the bleeding, especially the female bleeding or the male having any kind of the bleeding or hematuria, or the bleeding is happen in the anal region. All kinds of the bleeding to be taken place by using this spleen 6 point. So hopefully you understand this point. But this also junction of the spleen meridian, liver meridian, kidney meridian, 3 meridians are joining together this particular region, because all the meridians, the spleen, liver, kidney meridian starts from the foot and then it ends on the chest. It starts from the foot and ends on the chest. So therefore all the 3 meridians starting from the foot. So there is the one pathway is there. In that pathway it encircles. It encircles all the 3 meridians. So therefore that particular region, 2 points I wanted to tell you. Here Geoxin means is the K8 and then spleen 6. Both the places there is an intersection to be taken place. The entire area to be known as a lower Tanthian area, where the 3 in meridians are intersection to be taken place. Now come to the spleen 7. Spleen 7 again, it is the 3 chun proximal to this particular point, but this point is located on the flexor hallucis longus muscles. Flexor digitorum longus muscles. So in these muscles, the spleen 7 is good point, but spleen 7 point is the most imperative point to treat for the uterus prolapse or the vaginal prolapse or the rectum prolapse or the slip disc prolapse or any kind of the chest muscles get prolapse, or the wasting is there, the muscle wasting is there, ham wasting is there, arm muscles or the gluteus muscles or the breast muscles wasting is there. So that time certainly you can use. And also there is a varicose veins and also diabetes mellitus. These 2 points also you can use for the diabetes mellitus as a clinical practice. You can randomly use this point. Otherwise this is the command points. This will be more powerful than these points. Now spleen 7 points for the muscle wasting, numbness, burning sensation, pain on the lower extremities, and also varicose veins can be treatable by using this point. Come to the DG. DG point is, try to find out there is a spleen 9 first and then we'll go for the spleen 8. Where is spleen 8 point is located? Spleen 9 point. Now you try to touch and feel. This is the tibia. This is the posterior. This is the anterior border of the tibia. This is the posterior border of the tibia. Then you press to tibia. You press to tibia and come forward. You press to tibia, come forward. Where you can find the tuberosity, there is a stoppage. You come from here. You come from the spleen 6, you come from the spleen 7, you come from the spleen 7, upward direction, easily you can go. Now it is top. Now it is top. That stoppage place to be known as a spleen 9. This particular area to be known as a spleen 9, anterior and inferior to the medial side of the head of the crest of the fibula, this point, tibia, this point to be known as a spleen 9. So spleen 9 is the grand sun point and sedative point. That's the reason I sedated this point. So I sedated this point, I sedated this point. This is the grand sun point, this is the sun point. But both the points anti-direction I applied, but this points I applied at the towards the energy flow, since it is the mother and grandmother points. But in this way we activated from here, but this point from here, but 3 chun distal to this area, this point to be known as a spleen 8, that's called as a DG point. Spleen 8 is the DG point, D-I-G-I. Yes. So now we understand spleen 9 is the great point to detoxify. This in fact is the diuretic point. This point to be known as a diuretic point. So this also controls the bleeding because it is the C cleft point of the meridian accumulation point. But it all the blood related disorders you can treat by using the spleen 8 point and also spleen 10 point together you can use it. But however, spleen 9 is the day-to-day clinical practice. We use this point when the patient is complaining, I do have the pain on the medial side. This is the medial side of the knee pain. This is the lateral side of the knee pain. This is the anterior side of the knee pain. This is the proximal side of the knee pain. And this medial side of the knee pain having the pain. So that time there is the ACL related problem. Patient says, I have the pain here. Then you remember this sports injury or the athlete's injury which causing the pain on this region. Due to that reason, there is a nerve called as the medial side of the genicular artery is affected. The medial side of the muscles. So this muscles to be known as a gastrocnemius muscles. This muscles to be known as a gastrocnemius muscles. This muscles to be known as a sartorius muscles. This from the ACEs, anterior superior iliac spine. From here the muscles starts and then it's terminating on this region. But this to be known as a ACEs muscles from here to here. This is the longest muscle in our body to be known as a sartorius muscles, but that particular muscle, this point is located, this called as a spleen 9. Then spleen 10 is the most imperative point. Day-to-day clinical practice we use this point. Now you can understand this is the entire part to be known as a patella. This entire part to be known as a patella. Right, this is as a patella. From this is the medial, this is the medial, this is the medial end, this is the medial end of the patella. From here, this is the medial end of the patella. From here, 2 chun above from the medial end of the patella, and then exactly little inferior. Right, 2 chun above from the patella and then slightly inferior to this point to be known as a spleen 10. So now you just apply this point as a the ha C, that's called as a C high point or the su high. Su high means is the blood communicating point or the blood meeting point to be known as a spleen 10 point. So these points are the day-to-day clinical practice you wanted to use. Out of 21 points, these points normally we use for the all the conditions of the related to the spleen and other all the internal organ related disorders. Now we selected on the spleen meridian on the left side. Same points can be applicable on the right side. That to be considered as a pancreas meridian as well. That to be considered as a pancreas. If we wanted to use those points you wanted to use on the right side, that indicating right side you are using, that means that you are treating for the diabetes mellitus, but this side you are using for the muscular system and also for the digestive metabolism related disorders. Now I'll just wind up this, then I'll go to the other points. Yes. So now spleen 10, we have seen 2 chun proximal to the medial end of the patella. This is the spleen 10. From here 6 chun proximal, 3 chun plus 3 chun, 6 chun proximal to this spleen 10. The point is located, this point to be known as a Chi-men. This is a spleen 11 point. Spleen 11 point we activated. So that means this point is located on the adductor muscles, adductor longest muscles of the inside of the thigh muscles. Now we will see that this point where exactly is located. Now we understand about this pathway, exactly where the belt is there. On the belt region where there is the pubic hair is there. Pubic hair is the hairline of the pubic region. Where the hair started, that area to be known as a pubic symphysis area. From there, from here in the central line, this is the central line. From here 3.5 inches, 3.5 inches lateral from the midline, but you palpate, you press to the skin. You press to the skin, the patient, if we feel that there is a pulse is there, that pulse to be considered as a femoral pulse. If the pulse is indicating, pop-upping the pulse, that femoral pulse is good, that femoral artery is good, femoris vein and then now is good. If this is good, then the lower limbs are good. Try to find out for the pulse diagnosis we wanted to see over here. This also one of the macro pulse diagnosis. Then we don't want to touch here, otherwise we ask them to give the pressure. 1 2 3 4 5 1 2 3 4 5 1 2 3 4 5 to release the stress which is existing here, to open up the veins and then arteries. From the femoral artery it opens to the downwards direction. This is one procedure. So we need not to apply the needle, so we shouldn't rupture to the artery or the vein or the nerve. Now we'll come to the, so it's another point, spleen 13. I told you spleen 12 and then spleen 13, spleen 14, spleen 13. Spleen 13 is again, it is the fortune lateral. This area you remember, this particular point is spleen 13. Make sure once this is the appendix point, this is the right side. However, I selected on the right side, this is the appendix point. Once we insert the needle, so here, not very deeper level, don't apply the needle more than 1 chun. If you apply, for the normal adult, if you apply the more than 1 chun needle, then there is the peritoneal cavity is there, that cavity get the rupture or that cavity get the hurted, and due to that reason hemangioma or the hematoma will happen. When the hematoma means inside the blood will going to clot, then that will become the bulge. If there is the bulge is happen, that takes longer time to get the recovery. That's the reason better you just apply the half chun or the 1 chun. If the more obesity you can use the 1 chun, otherwise is the half chun is quite good. But when the patient is complaining, sir, I do have the pain in this region, but this particular region on the right side especially pain is there, that there are the 2 conditions the patient gets the pain. One condition of the pain to be known as a appendix pain, the second condition of the pain to be known as a renal pain. The renal kidney system comes here, and then this is the ureter. When the ureter having any stagnation, there is the stones get blockages in the ureter pipe of the ureters, so that will junction is on the urinary bladder. In the pathway they will get the pain. Then you ask them to have any urine related problem or the back related problem, or this region having the pain, that indicating totally either only this side, only one particular spot pain, then the appendicitis pain, or there is the pain is radiating pain is there, that to be considered as a urinary related, renal urinary related disorders, or the UTI, urinary tract related infection is happen. Then you just ask them to do the ultrasound scan to understand what level of the stones are existing, and based on that it is advisable. If it is less than 8 mm stone is there, then you can treat to the patient. If it is more than 1 inch, that means is the 1 centimeter above the stones is there, then better ask them to go for the lithotripsy and other procedures. Hopefully you understand this point. The second, the another is the taheng. Taheng is you come from here, this is the nipple. From the nipple you just come down. This is the entire muscles to be known as a rectus abdominis muscles, and this muscles is the deep muscles. This is called as a extensor abdominis muscles. When you go for the deep muscles, this is the superficial muscles. You go for the deep muscles, that's called as a iliopsoas muscles. When the patient having the back pain, so that time this muscles also important to treat for the back pain. Back pain you are treating, patient is not getting relief, then you just think that abdominal muscles, the deepest muscles which is connecting to the vertebra, that having some problem, you treat on the anterior muscles of the abdomen to treat for the back related disorders. Now from here you just come down. From here you just come down, and at this point to be known as a taheng. This point to be known as a taheng. So taheng means the great horizontal point to be known as a taheng. Now 4 chun I told you, 3 chun plus 1 4 chun. If we measure like this, there is the gap is there, but this to be considered as a 5 chun. 5 chun. We shouldn't measure like, that's the reason always what we should do, proportional measurement we should use it. But now you can see this is as a 3 chun, this is as a 4 chun, this is as a 5 chun. The from nipple to here is how many chun? 5 chun is coming. If you measure like this, 3 chun, 4 chun, you are applying here, but the point is not absolutely right point. Better you can use it, this proportional measurement, and then you can apply this point is a spleen 15. 1.3 chun distal. 1.3 chun distal to this point to be known as a spleen 14. This is a spleen 14 point. Now we'll come to the spleen 16. So spleen 15 and then again a spleen 16 point is again 3 chun proximal. 3 chun proximal to the spleen 15. This point to be known as a spleen 17. Spleen 17, 16, 15 and then spleen 16. Then spleen 17 we apply this shidu. So again it is, this point is spleen 3 chun, again it is the 5th intercostal space, and then to 6 chun lateral. This point to be known as a spleen 17. Spleen 17, then again spleen 18, the point is Tiansi, 2 chun lateral to the nipple. This is spleen 18. Then spleen 19, that is on 3rd intercostal space. This point is located spleen 19. Then spleen 20, the point is located on the 2nd intercostal space. But liver 1, lung 1 point is here. Lung 1 point is here. Right? This is the Xiang. This is the Tianxi, Xiang and Surang. And then the last point to be known as a Tapao. So now this is the anti-axillary crease. From the axillary crease, this is the 4th intercostal space. This is the 5th intercostal space. This is the 6th intercostal space. This point to be known as a spleen 21 is the major collateral point which will be useful for all the chest related problem. This is the serrator anterior muscles. This is the pectoralis major muscles. These points are located, but this is the muscular related problem, the serrator anterior related problem, or the shoulder related problem, or the shoulder blade related problem, or the back related problem. This point can be taken care. This is the lymph vessels or the lymphatic system of the spleen. When you wanted to use on the left side, this point is really good to treat for the spleen and then pancreas, especially on the spleen on the left side would be better. So this is the great dabao, ta pao. Ta means Ta means is the great. Bhav means is encircling or envelope or covering or the closing or scattering the energy to the entire system of the region. But major physiology of this one particular point, anywhere in the body, the whole body having the pain. I have like a pathetic pain. I'm really suffering for the pain of the whole body. So that time you select this point, spleen 21. Bilaterally you can use it, that having the certainly great relief, because this is the master collateral to all the collaterals. This is the collateral. Collateral means is the luo connecting point. But luo connecting point, how many luo connecting points are existing? Yeah, 16 luo, 15 plus 1, 16 luo connecting points. But 16 collateral points. Master for all these 15 collaterals is this is the 16th collateral. That to be known as a tapav. So therefore, luo connecting points are the major role we do have, which is connecting to the exterior. Husband and wife is connecting points to be known as a luo connecting points, but all the husbands and all the wives of the internal organs and the fu and then zang organs are meeting point to be known as a tapav. That's the reason this is a great point on the spleen meridian for the day-to-day clinical practice we can use for the number of the conditions. Thank